Okay, welcome back. Thank you all for uploading your assignments. The first assignment of this MOOC patient journey. And the first assignment was about defining actors. And it can be a bit hard to define your actors because in this assignment you do not have a design assignment yet. But we hope you managed and we saw that you managed. We will discuss the different steps you took this week. And I will start with the second step about identification of the actors that you saw in the case video. I can show you a couple of examples. As you see here, you immediately started drawing icons. And you're right, when you look at the case video, of course you have the patient herself, the male and the female, patient him or herself. They go with the bus to their appointment. So you could say that the bus chauffeur is also an actor. They enter the waiting room, they see the other patients, peer patients, when they share experiences, so they influence how they see and how they experience their illness. There's family. There's not family present at the appointment, but there's family present at home, discussing the hip business, and of course they have an appointment with their doctor. Yes.
Yeah, well,
continue.
Thank you, Renate. If you look to step 3, then we are talking about non-human actors, and it can be very broad, and it's also exactly what we see in your proposals. It is also very broad. So it can be the public transport, the walking aid, the street facilities. And one of the students was talking about the space, the climate, and the lighting. So all of them can contribute indeed to the experience and the comfort, for example, that the patient feels when he's waiting in the waiting room. So it can be very broad. And I think it will be very wise, especially at the beginning, to be also very broad, that you look to all the different non-human actors in order to see in order first to identify, but that you then later on can bring it in relation with your design assignment. Probably if you will design something differently, then the lighting, for example, is less important. But if you talk about the comfort or how the patient feel when he's waiting in the operating or the waiting room, then the lighting can play an important role. So I think for this stage it's very important to keep it very broad.
Yes, next step is to identify the actors, the human and the non-human actors that are relevant for the patient but outside the video. So you have to think a little bit, the type of journey or the type of experiences the patients already have or will have in the future. So you can think of partners who are often responsible for taking care of the patient at home. So it's called like an informal caregiver. Medication can play a role, but it's a bit discussable whether that's an actor or not. So an actor is something or someone that has an active relationship with the patient. Medication is active, of course, but so it depends a bit on the type of assignment you'll have in the end. It can be the doctor, it can be the operating team, the operating nurse, it can be the physiotherapist, or it will be the physiotherapist in the end. I have I can show you an example. This is an example of a team map, a stakeholders map, it's called. It's not an example from hip surgery, it's an example from child oncology. And here you see mapped all the different stakeholders that are surrounding a child with cancer. And it's also clustered in different groups that surround the patient, because it can help a little bit. So what you see now also with your assignments, that it's a bit, well, you are searching a bit for the different stakeholders, but it's a bit, well, only lists, or a bit, you could say, a bit less structured. Here you already see a start of a structure, I guess, so it's around the patient. But it can help to think of what kind of a task or a goal does a certain stakeholder has, and can you group them? So here you see, for example, so this is for child oncology, you see the psychology team, you see people from school, the psychologist, but also the educational worker. You see the medical team with the nurses and the doctors and the social workers. And in the middle always, of course, is the patient and his or her informal caregiver. Yeah.
And I would like to add, basically also, I think what important is, and we saw it also in the video, there were two different patients. The one was in the recovery phase and the other one was in the early stage. So depending on the phase where they are in their illness, I think will also identify all the human and non-human actors within this context. So based on how far they are in their own journey, will also define what kind of interactions the patient has with the different human and non-human actors. So, for example, here one of the students also mentioning the rehabilitation phase. So this is indeed important for the female patient, and it will also define different walking aids or the physiotherapist that she is seeing. So I think it's important to include it here also the phase, the stage of the patient journey, and also the context which is combined with that.
Yeah. Oh, and the last step, the interaction between the actors. That's the one you will do.
Yeah. Well, in the dependencies, and I think it what Marijke showed you this example. I think it's also a structuring. Till now it was you are just mentioning, but now it's, I think, also structuring and identifying what kind of independencies are there, what kind of interaction take place with certain actors or with certain non-human actors. So I think this part is more important to structure the identified actors, and also to see what kind of interaction will take place. Probably you will see that some interdependencies will very temporarily or very short, but you will also see that some of them will continuously come back during a certain period. You will also probably identify that certain interactions has a big impact on the patient, how he or she experienced the illness, or how to deal with the pain, for example, and the other less important. So I think it's important to think about the structuring and the impact of the interaction which will take place, and how it will guide the patient further in their future journey.
Yeah, here you see an example for one assignment. So here you see the patient and all the different actors surrounding him. So the general practitioner, girlfriend, informal caregiver, family, friends, insurance. So it's a start. It's not complete yet. Like physiotherapist, surgeon, nurse are all missing here still. But it's a start, and it gives the relationship between the patient and the different actors, but also the type of relationship. So support, money from the insurance companies, and providing answers to questions from the general practitioner.
Yeah, maybe even also good to think about what kind of emotions the patient have during certain independencies. That will be also interesting to include in this part.
So thank you very much for your assignments, and we will hope to see you again next week.
Yeah, thank you.